everyone. A very good afternoon to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. So I welcome you all to this Insta Live, and this live is going to be very informative, very interesting, because today we are going to talk about acne issues. Now, most of us has gone through that phase of acne vulgaris when we attained our puberty and when we were in our teenage or, young adolescence. And we all know how difficult it is. And we also, feel there is a moment when we all feel that it's just not about appearance. Okay, appearance is there, but deep down it affects our confidence level, it affects our mental health, and many a times people goes into depression just because they are not able to deal properly with acne issues. So awareness regarding acne is very important. How to prevent it, how to maintain a skin regimen where we can make a healthy barrier and we don't have acne, and in case we have acne, what to do, and most importantly, what not to do. So these days market are flooded with products, and we are so much experimenting with our skin. Is it a good thing or bad? We'll try to understand all the various aspects of acne with our expert, who is Dr. Prachi Mahajan, who's going to join us from Mumbai shortly. So Dr. Prachi Mahajan is a highly skilled dermatologist, dermatosurgeon and cosmetologist. She has done her MBBS from Dr. Vasantrao Pawar Medical College and Research Center, Nasik, and her post-graduation from Dr. Vallabhbhai Nanavati Hospital, Mumbai. She has done her internship from Kem Hospital, Mumbai, and she has also completed a fellowship in aesthetic medicine from Disha Skin and Hair Institute, Thane, and currently she serves as the director at Dr. Prachi Mahajan's Skin, Hair and Aesthetic Clinic in Kalyan, where she specializes in diagnosing and treating a wide range of skin, nail and hair conditions. Her expertise also extends to performing various dermatosurgeries and cosmetic procedures, and she is dedicated to advancing her skills and contributing in the field of dermatology through commitment and collaboration with top professionals. So Dr. Prachi Mahajan is going to join us soon, and today we'll talk about acne. Now, as I was talking, acne is something which is so depressing, and it's more important to understand why we need to keep ourselves away, especially in case we have acne issues, from various home remedies or DIYs, because these DIYs, do it yourself or acne hacks are so much in trend these days. Now with social media and so many influencers, they are eventually also endorsing various products. Market is flooded with products over the counter. We get so much in the name of skincare, maintaining a good skincare routine. But then, is it a good thing to experiment with your skin every now and then? Is it a good thing to apply whatever you feel like, or whatever whoever is coming across and advising you something, or is it going to harm or worsen the acne even more? Acne is something, we all will agree that acne eventually will go out, but then the scars, the marks that it gives, that it leaves, is so much difficult to deal with. तो कहते हैं ना, एक्ने तो चले जाते हैं, लेकिन एक्ने के स्कार्स, एक्ने के दाग नहीं जाते, और कुछ दाग वाकई में अच्छे नहीं होते, जिसमें से एक है एक्ने का दाग. तो अगर हम चाहते हैं कि हमारी स्किन पे कभी एक्ने हो ही ना, और वो स्कार्स एटलीस्ट ना हो, तो एक्ने को प्रॉपरली ट्रीट करना इज वेरी इंपॉर्टेंट. So what are the various acne management procedures? What are the various treatment options? What we need to do, what we don't need to do, and these are all the things that we are going to talk about in today's session, where we are going to be joined by Dr. Prachi Mahajan soon. So today we are going to talk about acne management. Again, when a person attains puberty, when he or she is in their teens, or someone as a young adolescent, they also have acne issues, because it's a good sign. It's a good sign because it says that, okay, you are growing and you are growing well. So a lot of hormonal changes are happening, and it pops out over our skin in the form of acne. So again, it becomes very important because that's a very tender age, and there's so much of going on in a teenager's life. And acne is so depressing, as I'm continuously saying, that it is just not a superficial issue. Deep down, it also affects our mental health, mental peace, and we get sleepless nights when we know that we have these acne issues, and how I'm going to look in my farewell party or my welcome party in the college, etc., etc. So it becomes even more important to talk about acne and also understand how we can manage acne. Another very common tendency we all have, क्योंकि हमारे देश में, हमारे समाज में ओवर द काउंटर मेडिकेशन बहुत आसान है. बहुत सारे केमिस्ट शॉप्स हैं, हम उन केमिस्ट शॉप्स पे जा सकते हैं, बिना प्रिस्क्रिप्शन की दवाई ले सकते हैं. और ये जो एक आज़ादी हमें मिली है, इसका बहुत नाजायज़ फ़ायदा हम उठाते हैं और इसके नुकसान हम ही को होते हैं. तो वो किस तरह के नुकसान हो सकते हैं अगर हम ओवर द काउंटर मेडिकेशन, और ख़ास तौर पे एक्ने जब होता है तो हम किसी भी केमिस्ट शॉप पे चले जाते हैं और हमें लगता है कि जो केमिस्ट वाले भैया है वो कोई हमें टॉपिकल एप्लीकेशन दे दे, कोई क्रीम दे दे जिससे बस 2 बार लगाओ और वो एक्ने ठीक हो जाए. और वो इनिशियली हमें बड़ा अच्छा लगता है, क्योंकि वाकई में वो एक्ने जो है वो बहुत जल्दी सबसाइड होने लगता है. तो इस पर भी हम बात करेंगे कि किस तरह से एक्ने इश्यूज जो है वो होते हैं, और क्या ब्लंडर्स हम कमिट करते हैं जो हमें नहीं करने चाहिए, क्या करना चाहिए, क्या नहीं करना चाहिए. तमाम जो पहलू है इस पर हम बात करेंगे. और मेरे ख्याल से हमारे साथ, जी हाँ, तो हमारे साथ जुड़ गई हैं डॉक्टर प्राची महाजन. अ वेरी वार्म वेलकम टू यू, डॉक्टर महाजन.
Thank you. Hello.
So, yes, doctor, are you getting my voice properly?
Yes.
Okay, wonderful. So, doctor, today we are going to talk about acne, and acne is such a chronic and common skin condition. I'm sure most of us has gone through that phase of acne vulgaris, or acne when people have this oily or acne prone skin, or adult acne is equally common these days. तो acne पर बात करनी बहुत जरूरी है. ये जो बारिश का मौसम इस वक्त चल रहा है ज्यादातर जगहों पे, इसमें भी कई बार हमें एक्ने इश्यूज होते हैं, तो इन सब पर हम बात करने की कोशिश करेंगे. लेकिन सबसे पहले डॉक्टर आपसे यही जानना चाहेंगे, व्हाट इज एक्ने, हाउ इट इज कॉज्ड?
See, acne is basically a chronic condition which is caused by inflammation of pilosebaceous unit. जैसे कि हमारा जो हेयर फॉलिकल है, there are multiple hair follicles on various parts of our body, including face, trunk, then arms, chest area, everywhere. So ये जो हेयर फॉलिकल होता है, ये एक पाइलोसेबेशियस यूनिट का पार्ट होता है. ओके, सो इसके अंदर सेबेशियस ग्लैंड्स होते हैं, फॉलिकल होता है एंड हेयर होता है. So anywhere inflammation on this particular site, maybe a sebaceous gland हो गया या फिर follicle हो गया, so वो duct हो गया. Okay, so उसके inflammation की वजह से block होता है. block की वजह से the fluid can't, the sebum can't go out and it can't come in. So ये block की वजह से वहाँ पे infection होता है, inflammation होता है, pus formation होता है, and then it reflects out of the skin as a pock, as a papule, as a comedone, that is blackhead or whitehead, or as a pustule, or as a nodule, or as a cyst. So this is basically what acne is. Yeah.
जैसे डॉक्टर आपने बताया अभी, we see various forms or grades of acne. Now, blackhead, whitehead, as a layman, this is what we know. Then you also mentioned about pustules, nodules, etc. We would like you to shed some more light over it कि क्या various types या grades होते हैं acne.
So there are basically 4 main grades of acne. First, grade 1. Grade 1 will comprise only of comedones. Okay, the maximum amount of comedones can be seen, and yes, a few papules can also be appreciated. Okay, grade 2, there will be a maximum amount of papules. Papule is just a pop over the skin. It is a pimple, which in local language which we call. Okay, so in grade 2 there will be maximum amount of papules, and there will be a slight pustules can be seen. Okay, grade 3 there will be maximum amount of pustules. Okay, and slight nodules can also be there. Nodules and pustule, yes, there are two different terminology. Pustule is something which will be little bit of firmer to softer in consistency, but nodule can be little harder in consistency. Little harder. Not, I'm not saying harder, but yes, it will be little harder. Right? So, and grade 4 is maximum amount of pustules, maximum amount of nodules along with cyst formation can be seen. Cyst is something which is hardest, more than nodule, more harder than nodule. So, yes, likewise, there are 4 grades of acne.
Now, doctor, we all know, because acne is such a common and chronic thing, that acne eventually will subside. Then the scars, that marks that they leave is so difficult to treat, and many a times it stays forever, ever and ever. So my question to you is, in case, as you said, there are various grades. In case we treat it well in time, as soon as we start seeing acne, be it this form of, a white head, black head, papules, etc., before it becomes really big and painful, if we go and consult the correct person, which is a qualified dermat, are there chances that it will get treated properly and then we won't have the issue or the problem of scars or marks, etc.?
Yes. See, whenever we see just a pop on the face, we don't actually we matlab the lay person will think that why to go unnecessary to a doctor. I will treat on myself. Let's see how it works. So we start applying a different type of things like turmeric, then like honey. Okay, like not whatever things are there in our kitchen, we try to take it and we try to apply it. So that is going to cause more and more damage to the skin. That is going to cause more and more inflammation, more infection. Okay, so yes, properly going further to a dermatologist, qualified dermatologist is very important to avoid this type of complications. Okay, and complication acne से भी ज्यादा वर्स होते हैं. acne के complications को bear करना, सोसाइटी के सामने फेस करना. It is very annoying for the patient also, very depressing for the patient also. Okay, so yes, going properly, when you just start noticing that yes, pimples are coming to me, there is something wrong, something somewhere, something is going wrong internally. So yes, properly going to a dermatologist is very important in order to avoid the complications of it. Yeah, like
Right. So as soon,
hyperpigmentation.
yeah, so as soon as you see acne popping out of your skin, or please go and consult a qualified dermat rather than running inside your kitchen and start applying everything on your face. Because you mentioned these home remedies, Dr. Mahajan, I would also like to add to it, toothpaste लगाना acne में एक बहुत common trend है. Garlic tak log laga lete hain, lemon juice, they try everything. Then these days, because we have social media influencers and most of them not are not qualified dermats, but then they have so many DIYs, quick fixes for acne or skin related issues. ये लगा लो, वो कर लो, ये खा लो. ब्लीच भी कई बार घर पे ही करवा देते हैं, या फिर वेरियस जो ट्रीटमेंट्स होते, प्रोसीजर्स जो होते हैं, पील्स जो होते हैं, वो भी घर पे करवा देते हैं वो इन्फ्लुएंसर्स. But then my question to you is, how harmful can these be?
This basically can actually increase the inflammation thing. Like what I said you in my introduction, that what is acne is basically a chronic inflammatory condition of pilosebaceous unit. So it will basically clog more and more. Okay, it will increase the chances of block. It will increase blockage of more and more pilosebaceous unit. Inflammation will be increased, because of which scarring will be more. Scarring होने के बाद जो scarring का जो treatment है, there will be collagen loss from over there. The barrier will go over there. The skin will be actually burnt, okay, of that particular area. So yes, there are treatment available for that also. There is treatment. We can try for that also treatment, but unnecessary to go on that thing. If we can treat it medically, if we can treat it by application of certain gels, certain creams, certain and oral medications, certain precautionary measures, certain dietary modifications. If we take a properly step for that, then yes, avoiding of such complications can be taken care.
Another very common tendency in our society is to go for over-the-counter medication, over-the-counter topical application in case of acne. Most commonly, सबसे पहले जैसा आपने कहा, कुछ होम रेमेडी, टर्मरिक लगा लिया, बेसन लगा लिया, मुल्तानी मिट्टी लगा लिया, उससे लगा कि नहीं, acne ठीक नहीं हो रहा, they are continuously coming up. Then the second step that normally we all follow is to go to a chemist shop कि भैया कुछ दे दो, acne pimple हो रहा है. And we fall in love with that tube or cream, whatever is giving to us, because initially they work magically. हमें लगता है कि देखो, हमने डॉक्टर की कंसल्टेशन फीस बचा ली, एक ट्यूब ले लिया, and it has worked wonderfully on our skin. Plus, पूरी skin भी glow कर रही है. But then, after a certain amount of time, we understand that we are getting addicted to that particular, tube. And the moment we stop applying it, we see a bundle of acne. So, what's your take on these over-the-counter topical applications or medication?
See, likewise, there is doctor. Likewise, many people they go with search like Google search, Instagram search, Facebook search, and then they try to follow that particular things. Okay, and then they go to some of them having had their chemist bhaiya and chemist kaka and mama and everyone. They go there. अच्छा ठीक है, आप make tube दे दो. Yes, there is one tube which I have come across in my practice recently last month. छह का दम. The tube ka name was Chekadam. Six ingredients in one thing. Everything was there inside that. There was antifungal in it. There was steroid in it. There was anti-acne thing in that. There was everything. All the six ingredients.
Combination.
कुछ ना कुछ का तो असर सबका मालिक एक सो कुछ तो असर हो जाएगा किसी का तो इंग्रेडिएंट का असर हो जाएगा एंड असर नहीं होता है ऐसा नहीं असर होता है इसके लिए लोग खरीद रहे हैं okay but yes inflammation will be reduced but yes infection won't go with that okay in fact inflammation will be reduced people will feel better after like you said people feel better after applying that particular thing but कब तक एक हफ्ते तक 3 दिन तक 4 दिन तक 5 दिन तक उसके बाद जो बाउट आने वाला है वो उससे भी ज्यादा सीवियर होने वाला है ओके सो यस it should not be likewise. Proper consultation is very important. Depending upon the grades of acne, there is treatment option available. Like grade 1 के लिए
अच्छा ये जो कॉम्बिनेशन ट्यूब का क्रीम का आपने जिक्र किया डॉक्टर इसकी वजह से क्या हम रेजिस्टेंस भी क्रिएट करते हैं मतलब इफ आई एम अप्लाइंग एंटी फंगल एंड आई डोंट हैव एनी फंगल इश्यूज and I'm still applying a combination cream because it has, as you said, 6 ingredients put together. So are there chances, and probably is this the reason why so much cases of resistance is increasing day by day?
Yes, exactly. Application of wrong application of creams, ointments, and gel is creating resistance, and that is very difficult to treat that patients also.
Okay. Now, another very common thing that we love doing is to consult our friends or family members. For example, मेरे किसी friend को 3 महीने पहले पिंपल हुआ, उन्होंने डॉक्टर को दिखाया, उनके पास प्रिस्क्रिप्शन है, तो वो मुझसे बोलेंगे कि why are you going to a doctor? You have my prescription. Go get the medicines that you start treating yourself. You'll be all right. Because मुझे भी पिंपल हुआ था, मैं ठीक हो गया था या गई थी. And we fall for it again, and we do that. So why it is important to go to a doctor and not go by what the friend was advised by a doctor? Because उसमें भी ये कहते हैं कि देखो हम तो डॉक्टर के पास गए थे ना तो हमारे पास तो डॉक्टर की प्रिस्क्रिप्शन है तुम भी ये फॉलो कर लो. See, everybody has different, likewise we said different grades of acne. So depending upon the grade, we have to go for the treatment. Okay, and everybody has different. Plus, there are different comorbidities also. Or some patient might have, like female patient can be having comorbidity like PCOD, PCOS. So in that case, yes, proper treatment of the primary disease is very important rather than application of just some gels and cream. It will resolve for some time, but then it will not cure it permanently. So that is important to go to a dermatologist. Some people might have diabetes, some people might have androgen issues, adrenal gland issues. So that is very important. Hormonal imbalances can be there. So yes, proper addressing of the hormonal balances that can be done only not by friends, but yes, by dermatologists and by doctors. Right. So it's always important to go and consult a qualified dermatologist rather than going for home remedies or over-the-counter applications or self-medication or go by what your friend or relative have done. So please go to the right person if you want to get relief, get it treated, and also reduce the chances of getting the marks and post acne anti-inflammatory marks. Now, doctor, we always say that we can especially in medical field, that prevention is better than cure. So anyway, we can prevent having acne.
Yes. First of all, acne, like if we are in that age group, like we say, teenage group, yeah, it is very important to take care that time. Like avoiding of certain, like avoiding or we can't avoid anything. We have to lower its intake. Like we can follow some dietary advices. like reducing the amount of wheat or reducing the amount of junk food. Like once weekly going for junk food is okay, then going like twice a week or 4 times a week. So that can prevent acne. Then other thing is that if it's very difficult to reduce sweets if you're having a sweet tooth. But yes, if properly we have to, like I said, acne is an infective condition. So taking more amount of sugar in our diet or eating sweets and everything that will predispose more to infective condition. So that infection can be anything. It can be acne also. Acne is also a form of infection only. It's caused by your organism. It is P acne, propionibacterium acne. So yes, that is going to trigger the acne more. So we can reduce it like in our daily routine. And yes, pinching and pricking of acne has to be avoided. If some bout I'm having of acne, I have to go to a consult. Whether I'm not going due to some reason, due to my work or due to I'm having some important commitments. See, then it's I can delay it 1 to 2 days after I can go. But then till that time, don't pinch and prick it out because pinching and pricking will cause more and more severity. That particular acne can be more and more infective, and plus it is going to increase small acne daughter on the other areas of our face. So surrounding area
Right.
can also be affected. Okay.
Yeah. So
Uh, Dandruff issues. If somebody is having dandruff issues, then first foremost, telling this condition is very important that you are having dandruff. The dermatologist will ask you that you are having dandruff or not. But yes, you can also tell by your side because dandruff issues increases the T zone formation of acne. So the T zone, which is this area and this area, so it becomes more in that if they are having dandruff issues. So yes, correcting that is also very important. So these all things get addressed only when you are going to a right person, you're going to a correct person. So yes, that this is important. Yeah.
right. So you need to do all the, preventive measures. You need to take these preventive measures, keep your skin as healthy as possible. And Dr. Mostly people say following a good skincare routine is really important. But the problem is because again, there are various trends. Trends are continuously changing right now. Korean skincare regimen is very much in. People are following a 10-step skincare regimen. But the problem is that we can't be really consistent with 10-step skincare regimen. We need to have a very minimalistic, basic skincare approach. What can or what is a basic skincare regimen that we can follow?
See, we listen to if one person having acne, he's already taking treatment or maybe not, and other person who is having a healthy skin, non-acne. So first we will discuss for non-acne, uh, routine skin. So routinely, daily getting up in the morning, washing your face with proper face wash. Okay, that is important. After that, applying proper moisturizing the face is very important. And using of sunscreen is very important. Okay, even if you are having acne or if you are not having acne, using of moisturizers and sunscreen is mm, the only good step. Okay, best step. So that can be done in the night. In the night, cleansing of face is very important when you are before going to bed. Yes, it's very important to cleanse your face. Okay, so that is a normal routine part. And if someone is having acne, okay, so in that case, again, washing of face is very important, cleaning of face is very important. Yes. Then after that, whichever gels or creams are being prescribed by the dermatologist is very important to apply on the pimple. And then proper application of sunscreen is the most important step. Sunscreen, if there is moisturizer based sunscreen, then no need to apply moisturizer separately. If the sunscreen is not moisturizer based, then yes, moisturizers are very important part. Okay, before application of sunscreen. In the night, again, application or yes, sorry, yeah. So what I was, yes, am I audible? Yeah.
Yes, doctor.
Yeah. So what I'm saying in the if it's acne prone skin, then also application of moisturizers and sunscreen is very important. In the night, again, cleansing of face is most important. Okay, now in this, many people will say that we are having acne, but we are prone to do makeup because of we can't go like this at our workplace or some party function, we have to apply makeup. Okay, so in that case, with proper application of all the routine, that is face wash, gels, anti-acne gels, sunscreen, and the makeup products are very important. Okay, that makeup product should be oil free. They should be free from oil. Okay, it should not have, it should not block the pores. Okay, yes. So, and after that, at the end, cleansing again is important, so that whatever damage, whatever has been occurred to the skin, because little bit of damage can occur because of application of makeup products, that is everything is removed. So yes, you can take care of your skin by cleansing properly at night.
Right. So these are the steps that we can follow and make our skin more healthy and more radiant. Now, doctor, there are so many myths associated with acne. A very common thing that people believes is that they have a dirty face and that's why they are having acne. Or especially those who have oily or acne-prone skin, they'll keep washing their face again and again because they feel that it is the excessive oil that's causing more acne, and thus washing my face again and again with a cleanser is going to make my skin oil free, thus acne free. Is it correct?
No. Actually, the people who are having acne, the patients who are having acne are supposed to wash their skin only 2 times. Once in morning, once at night. Okay. जितना आप
Okay.
ज़्यादा face wash करोगे, उतना ज़्यादा skin will think that yes, you're washing the face, skin is becoming dry, I have to secrete more oil. So skin doesn't know. Skin is going to work of secreting more oil. जितना ज़्यादा आप face wash करोगे, उतना ज़्यादा oil secrete होगा, उतना ज़्यादा acne को predispose होगा. So yes, only 2 times washing face is recommended for acne patients, and non-acne के लिए yes, you can wash 3 times, but not more than that.
As you said, moisturization and applying sunscreen on a regular basis is very, very important. But the problem, especially those who have a, oily skin, they'll say already itna oil hai skin pe, already and my skin is producing so much of sebum. Why I need to add moisturizer to it? Or sunscreen se kyun main apne, acne ko overlay karu? It gives me a very dull or patchy look, etc. So they don't apply moisturizer or sunscreen on a regular basis. What would you like to tell them?
Yes. Yes, we face this question from our patients also, that why we should apply moisturizer. Already इतना ज़्यादा गीलापन है, इतना ज़्यादा itching है face पे, क्यों apply करें? Sunscreen की वजह से और ज़्यादा हमको बहुत ज़्यादा moistness होने वाला है. Why unnecessary we should? Then in that case, it is important. The role of both of these ingredients is very important. Both of these factors. First, uh, in acne, we prescribe patients certain gels like a topical, which we say topical applications. Topical application of azelaic acid, salicylic acid, benzyl peroxide, and we prescribe to the patients. Okay, so depending upon the grade. Sometimes, if the acne are like of pustular or nodulocystic type, in that case, even we give treatment options like oral retinoids. Okay, so oral retinoids, and if it is more and more severe, the inflammation is more, then also we give an option of intralesional corticosteroid injections on the face. So these things which we are giving for the treatment of acne, it is going to cause side effects like dryness of skin. Okay, so these moisturizers are going to take care of the some. There are some side effects of every medication. Whatever medicine is there in on this under the sun, having its effect also, it is having its side effect. So little bit of side effects of anti-acne medications, dryness. So that dryness of side effect is cancelled by moisturizers and also by sunscreen. Okay. So yes, and also moisturizers, they create a film over the skin, a protective barrier. Okay. Because of that, again the infection, the chances are reduced. Okay. And also other secondary infection is prevented. Okay. Other thing, it is sunscreen that after every acne, that is acne is an inflammatory condition. So after every inflammation, there is going to be little bit of hyperpigmentation. Okay. So this sunscreen is very important. It will take care of the hyperpigmentation thing also. Okay. So
Right.
hyperpigmentation can be properly taken care by sunscreen. Plus the UV radiation exposure, that also sunscreen is UV protective. That also it can take care of. Okay, so yes, that is so incorporation of moisturizers and sunscreen is very important. So we have to look for certain ingredients on moisturizers and like glycerin, hyaluronic acid. This thing is going to increase the tone of the skin. It is going to cause more and more collagen formation. So जो acne के बाद जो धब्बे होते हैं, जो acne scars होते हैं, that gets reduced if along with simultaneously we are using in moisturizers and sunscreen with anti-acne medications.
Fair enough. And doctor, because we are talking about acne, so when a person comes to you, when a patient comes to you with acne issues, are there certain tests that you normally recommend, or just by taking history, the clinical investigation, you are sure that what is probably the cause, etc.?
As I said, depending upon the condition. If a new fresh person is coming to me, if he's a teenager girl, if she's a teenager girl, or I would like to ask her first. I'd like to take a bad history that is she having regular periods or not. Okay, so that is important. So if she says yes, I'm having regular periods and all, then I'll just still try to investigate her more little bit by history. Okay. Then I would like if she says that little she's having irregularities in her periods, then I would like to go for certain tests. Okay, like serum testosterone, then DHEAS, then serum cortisol, or then I would like to go for serum estrogen test, which I would like to tell her like third or fourth day of menstrual cycle, she has to do that particular test. And then after that, I would like to see the report. If there is some issue in the PCOD, or if there is some certain issues like PCOD or PCOS, then I would like to refer her to the gynecologist also, so that simultaneously acne and her ovarian issue, ovarian dysfunction get corrected. Okay? So yes, that we don't do routine for routine patients. If there are certain zones, like T-zone of acne, mostly we will take history of dandruff and everything. And then if there is like acne on the lower half of the face, yes, surely we will try to ask more about the uh, irregular periods. That history we would like to go investigating that particular one. Plus, there are certain gastrointestinal conditions also which can predispose to acne. Like many people they say complain of constipation. Like so that in that case the constipation issue should be solved along with the anti-acne. Okay, otherwise here we are treating acne and then the actual cause is not being treated. So there is wastage of time, wastage of money. Okay, in that case we have to treat two conditions simultaneously.
Right. And what are the treatment options and procedures available, doctor, for treating acne and post-acne marks or scars?
Okay. So I would like to discuss all these things, like taking into consideration the grades. So if there is grade one, okay. So grade one, as I said, comedones, maximum amount of comedones and few papules. So in that case, I would like to go for topical therapy for acne, that is topical retinoids or topical azelaic acid or salicylic acid based formulation. I would like to go for that benzoyl peroxide, okay, along with moisturizers. Yeah, and if there are after that, if a patient is, I will like to follow up with him. If the patient is little less responding to that, yes, I would like to go for comedone extraction procedures. Yeah. Again, the next thing, if the patient is having papules, maximum amount of papules, then again topical medicines. I would like to topical gels, creams, or lotions. I would like to go for that. Yes, if it is still not resolving, then I would like to go for a chemical peeling session. If the patient is having grade 3, likewise, what I said, maximum amount of pustules and few nodules, then I would like to go for antimicrobial medications, like, and I would like to add an oral antibiotic in my treatment, and along with topical antimicrobial gels or creams with it, and benzyl peroxide or salicylic acid based combination or azelaic acid. Okay, there are certain laser therapies also I would like to do if it is non-responding. Okay, the last thing is nodular cystic acne. In that case, I would like to go for intralesional corticosteroid injection to reduce the inflammation and to break the hardness. Okay, for that I would like to go for that. That is a very last stage. And then along with that, I can also go for some chemical peeling options and certain ablative lasers. I can go for that.
Right. So various treatment options, procedures are there. What we need to understand is very important, go and contact a qualified dermat as soon as we see acne issues or any other skin related issues, and talk to your doctor, complete the treatment. That is equally important. Trust your doctor, that's really important. Now, doctor, because we are talking about acne, and initially also you said that many times people will have a lot of junk food, etc., which shows that food has some amount of impact on our acne. Plus, many times we listen people saying that don't have dairy products in case you are acne prone, or avoid eating sugar or chocolates, etc. So, any do's and don'ts, any dietary precautions that you would like to tell us?
Absolutely, yes. So there are certain food which can worsen the acne. There are certain food which can improve the acne. Okay. So the thing which is going to worsen, first we'll talk on that. The food which are having high glycemic index. Okay. So and also dairy products like starch is good. Daily drinking of chas is very good, but having of dairy products like which are having high glycemic index, like high carbohydrate foods, is not actually recommended. Already if you are having acne, yes, you should reduce it. And if you are not having acne, you can little bit, you can have it, but not on regular basis. Once in a week or two times in a week is okay. But yes, having acne, you have to put a control in this. And I again said of a high amount of sugar should be avoided if already having acne, or sweets, chocolate should be avoided. Okay, oily food should be reduced. Okay, so this measure we can actually worsen that, and there is something which is going to improve the lesions. Okay, so in that case, low glycemic index food has to be taken. Along with it, food which are like fish. Fish is very important. Okay, so omega-3 fatty acids can be also incorporated. So in that case, chia seeds can be taken. Chia seeds, 1 spoon of chia seeds daily has to be taken. So they are going to improve the acne lesions, and also they're going to prevent the acne form. Yeah. Also along with it, also fresh fruits are to be taken. Like fruits are antioxidants. Also I give vitamin. Also I give antioxidant medications also when I'm treating a patient of acne. These are going to actually improve the lesions also of acne. And yes, as a routine also, antioxidants is very important to keep away from acne, to prevent the acne formation.
Right. So take care of yourself, your lifestyle, and it will definitely go a long way in keeping your skin healthy, keeping your skin flawless, spotless. And in case you have some issue, you have qualified dermats. So please go and consult them. Dr. Prachi, before we sum up the whole session, any take-home message for our viewers?
Take home message is like, see, if someone is having acne, it is not, it has to be treated in time. Okay, otherwise unnecessarily it will lead to complications, and it will lead to scarring, it will lead to pigmentation, and it is going to disturb life. So why to go on that path? If properly treatment, properly investigations, properly consulting a proper dermat is very important in order to avoid that type of inflammation and infection. Yeah.
Right. So why just wait and make it more worse, make our issue? Because as I said initially, acne is just not about our appearance or a surface area. Deep down, there can be other associated medical condition, or deep down, it do affects our mental health as well. We get sleepless nights when we have acne, and in teenage, or as young adults, it becomes even more difficult to tackle with it. So it's important to go and consult the right person, which is a qualified dermat like Dr. Prachi Mahajan, our today's guest. Thank you so very much, Dr. Prachi. It was wonderful talking to you, and this was such an informative session. I'm sure our audience is going to be benefited out of it. Thank you so very much once again.
My pleasure. Yeah. Thank you.
Thank you, Doctor. And viewers, thank you for your excellent participation. Stay happy, stay healthy, take good care of yourself. Goodbye. Have a great day ahead.